And the fun part of my job is talking to people about what it is that bothers them. And sometimes when someone walks in to see me, I have to deliberately not jump into the analysis of the face. I have to think first, all right, what is it that bothers them? So sometimes people come in and they'll say, I really don't like my upper lids. And that's the thing that bothers me the most. And I wear my glasses a lot because I want to hide my upper lids. And my jowls bother me a little bit, but really it's my eye. And I may look at their face and say, the thing that I would want to correct is I would want to correct the jowls and I want to clean up your neck and I want to restore your cheek. But that's not what bothers them. So it is important that we figure out what people want, but it's also important that we offer them things that I think are reasonable. So for me, if I have a patient that comes in, like I just saw a patient just a few minutes ago in the office, and she came predominantly to discuss her upper lid. So that was the area of concern. And she said, well, I wear my glasses to hide my upper lids, and that's the area that bothers me the most. And then she said, but I really don't like my jowls, and I'm fine with my cheeks because I get filler in the cheeks. And I said, okay, I think we can do your upper lids, and we can do that under local. I'm actually in my operating room. And I think that's a reasonable choice. And I think for her, she is absolutely a candidate for a face and neck lift. I could make the neck much cleaner. I could restore the jawline. I could eliminate the jowls. I could reposition the soft tissue of the cheek without filler and give her a beautiful result. But right now, she's seeing enough improvement with a little bit of cheek filler that she probably doesn't need a facelift right now. And so when I present these options to her, I say, well, we can do your upper lids. We could do a face and neck lift. The eyes make sense for her. The facelift doesn't right now. Now, what I do tell a patient like that is use the filler in the cheek, but a day will come where the filler in the cheek is not going to be powerful enough to give you the rejuvenation that you're looking for. And it's going to start to make you look puffy and weird. And it's going to create disharmony in your face. And for those patients, filler isn't the answer. The answer is face and neck lift. And then once the soft tissue has been restored to a more youthful position, at some point you could use filler in the cheek again. But that's when the soft tissue, the tissue that actually holds the filler, has been repositioned. So there's where spending the time listening to the patient, but then giving them the best possible plan makes the most sense.